Hello again, this is Deborah Smithy, Missouri midwife. Hey, I thought maybe you would like to know what it is that is involved in a postpartum checkup. So in my practice, I do a lot of postpartum checkups. I come back when the baby is 24 hours old and do a checkup, again at 3 days old, 7 days old, and again at 3 weeks old as my standard postpartum home visits in the woman's home. And then at 6 weeks postpartum or so, the mom comes back to me for her final checkup and baby weigh-in. So what's involved in a normal postpartum checkup? The 1 day checkup that I did today, we check on the mom to make sure she's doing well. We ask her about her bleeding, color of the bleeding, the amount of the bleeding. Has she passed any clots? Are there any foul odors? Anything that might signal an infection? Of course, we check her blood pressure and pulse. We check her fundus to make sure that it's decreasing in size and not increasing. We ask her if she had any tearing or any bruising. We ask her how her perineum is feeling to assess that. We just want to see that everything is normal and getting better. For the baby, we do a head-to-toe exam every time we come to do a checkup. Specifically, we listen to the heart and lungs, and though we're not doctors, we've listened to a lot of newborn babies, and so we know what sounds normal and what doesn't sound normal. And if we find anything abnormal, then we refer to a doctor or a practitioner who can care for whatever abnormal thing we happen to see. So we listen to the heart and lungs, we count the respirations and the heart rate. We ask about the baby's peeing and pooping habits. Today, on the 1 day visit, then we expect to see that black tarry meconium poo, it should be turning a brownish by day 1. Is the baby nursing good? Does the mom have any soreness or pain in her nipples or in her breasts? Has the baby had anything to eat that didn't come from the mother? Are they giving pacifiers or baby bottles? That's a question we ask. Generally, I do not recommend using any pacifier or baby bottle until the baby is at least 3 weeks old, because during those first 3 weeks, that's when the mom's milk supply is going to be established. There are significant growth spurts for the babies in the first 3 weeks of life. And when the baby is about to have a growth spurt, it's going to want to suckle more. And if the suckling is done on a pacifier instead of on the mother's breast, then the mom is more likely not to have enough milk to support that growth spurt. So regardless, we usually make sure that the mom's not giving the baby a pacifier. Is that all? Oh, and we weigh the baby, of course. It's normal to lose a little bit of weight in the first week, but most of our homeborn babies are back to their birth weight by 7 days old. If they're not to their birth weight, then they're significantly gaining towards that, and a few of them have surpassed their birth weight by 7 days old. Anyway, that's your 1 day postpartum checkup in a nutshell. And if you saw our previous video, then yes, I finally did find a way to get to the lady's house where the road wasn't closed. It took me an hour and 20 minutes extra driving around finding roads closed right and left, but I finally got there. Anyway, check me out online. I'm the Missouri midwife, Deborah Smithy. MissouriMidwife.com, or morethanjustamidwife.com is my blog. See you next time. Bye.